I want to thank you all for joining us tonight for Critical Comfort, Fear-Free Practices in Emergency Pet Care. As a thank you for joining us tonight, you can use the coupon code COMFORT20 for 20% off your veterinary certification membership or renewal at fearfreepets.com, made possible by our friends at Virox. I'll also go ahead and provide this code in the chat in just a few minutes. Presenting shortly will be Marianne Manning. Marianne is the lead veterinary technician for the Behavior Clinic, the only behavior-only specialty practice in Ohio. Marianne earned an associate's degree of applied science in veterinary technology in 2005. Spurred by her basset hound who started to show signs of aggression, she acquired fear-free and low-stress handling certifications. Marianne became a Pryor Academy certified training partner in 2019 and a Cat Friendly Veterinary Professional in 2021. In 2023, she earned a VTS in behavior with the aspiration to help veterinary professionals and pet parents understand how animals live, behave, and learn. Although Marianne currently lives outside of Atlanta, Georgia, she continues to work for the Behavior Clinic remotely and in person. When Marianne isn't traveling to Ohio, she loves visiting national parks and spending time with her husband and their plethora of animals. For anyone just logging in, I want to welcome you to Critical Comfort, Fear-Free Practices in Emergency Pet Care. As a reminder, there are two options on your Zoom controls, a chat feature as well as a Q&A feature. We will have time at the end to address questions from the audience, so if you have a question, please use the Q&A box, otherwise it may get lost in the chat. A recording of tonight's presentation will be available for all attendees within 2 weeks. Marianne, we're so excited to have you with us here tonight, so on that note, I'll pass it over to you and we'll get started.
All right, thank you, Nick, for that introduction. And thank you everyone for joining me tonight to talk about fear-free practices in emergency pet care. Excuse me. As I actually worked in emergency care for a handful of years. So I know how stressful emergency is, and I know how stressful pets are when they come in. They're so stressed when they come in. So our goal with tonight is not to try to eliminate stress for those emergency patients, but it's to actually just lower stress. We want to make it as low stress as possible because we're not going to eliminate it. We're stressed, they're stressed. All we can do is try to help it. So what I want to start with is, why do we want to reduce stress? Well, it will make our patients easier to handle. We can actually get treatments done that need to be done, which means we're also helping our patients physically, but I also want to talk about helping them emotionally, because the brain is not separated from the body. It is all connected. So what they're feeling is going to come out physiologically. And then, of course, if we do all these things, it reduces our stress as a veterinary professional. So how are we going to do it? So tonight, I want to talk about how we change the way we view cats and dogs' behavior by interpreting their body language. I want to perceive the hospital, your guys' own hospitals too, through a cats and dogs senses, to show how stressful the environment can be for them and how it can increase fear, anxiety, and stress for them. And then I want to talk about making changes in the environment to decrease that fear, anxiety, and stress. And then we'll talk about how to handle our patients in a way to kind of alter the reactions when they are receiving our care. So first, let's talk about their body language. I want to abandon the labels. So cats and dogs that are coming to us for emergencies, if they're not being mean, they're not being unruly, they're not listening. And labels we've used in the past with pets are like fractious, mean, watch, you know, an orange sticker on the cage card sometimes, use caution. Those aren't really describing anything. Those aren't accurate depictions of what's going on. What the patients really are feeling is they're uncomfortable, they're stressed, they're fearful, they're anxious, they're possibly painful if they're coming to us in emergency. So what I want to do is not just look at them as being mean and fractious. I want to look at them as being stressed and uncomfortable, and then I want to call out the body language. So like literally say it out loud to your fellow teammates so you guys can figure out what is happening with this patient. Here is what I'm seeing. So they probably are stressed if this is, with the body language I'm seeing, and then how can we change it? So just to go over the difference between fear, anxiety, and stress real quick. Fear-free calls this FAS, so that just rolls off the tongue once you get used to it. But fear is a combination of physical, emotional, and physiological responses to a threat. So the body is preparing for fight or flight. So that can be compared to like if you were approaching the pet with some kind of apparatus that they haven't seen before, an ultrasound machine, a pulse ox, something like that. They might take a second to be like, do I need to run? Do I need to fight? That's what fear is. So anxiety is an emotional reaction of apprehension to a threat. So I think of like those cats that they only go in the car to go to the vet and then they don't love the vet. So every time they go in the car, they get anxious that they're going to the vet. And then stress is caused by events, caused by stressors. Usually once the stressor goes away though, your body will return to baseline. So I think of it as like I'm approaching a pet with nail clippers, they probably get tense. Their body language will show stress, but then once I leave with the nail clippers, they're back to normal pretty quickly. Now there are 4 F's of fear. It used to just be fight or flight, but now we have fight, flight, freeze, and fidget. So fight is vocalizing, barking, hissing, scratching, and biting. Flight is moving away. They're fleeing, they're leaning away, they're avoiding you or whatever they're afraid of. Freeze is more of they're just immobile. They're not moving, but they're still showing stress body language. And then fidget is they're not really fleeing, but they can't settle. They keep moving, they're weight shifting. We might also see displacement behaviors. And what those are is they're normal behaviors that are done out of context. So sometimes after a dog is stressed, or when a dog is stressed, they might scratch like their neck with their back leg. That's usually a displacement behavior. You might see a cat suddenly lick themselves. That could be a displacement behavior. Also, a dog just suddenly sniffing the ground. Like, unless I dropped a treat recently, I wouldn't expect them to sniff the ground if they've been in like the treatment room or the exam room for a while. So if they suddenly sniff, then I go, something's going on. Was it me approaching? What would have caused that displacement behavior? And of course, we have to count pain when we're looking at body language. Because again, we're talking about emergencies. So they're probably going to come in with some kind of pain. And to keep their FAS, their fear, anxiety, and stress low, it's recommended to give pain medication before an exam or at least before we palpate whatever's wrong. If we know that their leg is not joined right, we need pain medicine. If they're coming in for, vomiting, you think they might have an upset stomach, let's do pain medicine before we palpate that abdomen, because once you palpate that abdomen, that can skyrocket their FAS and then the animal might not be handleable anymore. So let's talk about body language. First, we'll talk about dogs. With dogs, I see it as they're either neutral, comfortable, or they're uncomfortable. And uncomfortable could be stressed, anxiety, fear. It can be pain. So to start with just neutral, comfortable, well, I should say when I look at a pet, cats and dogs, I look at 6 parts of their body. I'm looking at their mouth, their eyes, their ears, their body posture, their hair, and their tail. And I say all these parts because it is hard to get the full picture, especially in an emergency situation. But if you can zone into one, that can help give you like what's going on. So like if I zone into the tail and the tail is down or tucked, okay, that gives me an indication of, well, that's probably stress. Of course, if I see the tail doing that, I do want to look at the full body if I can, but that's also something I would call out to other employees so that somebody standing, in front of the pet or to the side of the pet or something can also get a better picture of like, I see this, they're tensing up, what else is going on? So back to the neutral, comfortable body language. I expect the tail to be even with the spine and a loose wag. So at the base of the tail, that's where we see that wag. The hair is going to be flat. Their posture is loose when they're walking. They might lean towards you. Their ears are loose and the natural position for the breed. I would say like all of this, the tail too, also natural position for the breed. If the tail's naturally up, there are some caveats to that, but what is natural for the breed, take that into account. And then eyes, they're just a normal pupil size. And then the mouth can be open or closed, but the lips are going to be loose. So here's my dog Floyd here on the right. So his ears in their natural down position. His pupils don't seem to be dilated. His mouth is closed, loose lips, almost always. And then his body is pretty loose. He's just hanging over a chair. So if we're talking about uncomfortable canine body language, starting with the rear, I would expect the tail to be down, maybe even tucked under, and you might see a fast wag. So it's important to look at what is the tail placement? Is it up? Is it even with the spine, or is it low? If it's low and wagging, I see that as stress. If it's up and wagging, it could be excitement, but still not neutral, especially if it's a fast wag. Now, the hair can be down as regular hair, or it might be up. You might see the hackles go up. That's called piloerection. You might also see like them get poofy at their shoulders or at the base of their tail. Their posture is going to be more stiff, standing still. You might also see them leaning away, moving away from you. And with dogs, you might see a front paw lift. A lot of times they'll do that when they're stressed, and especially in emergency situation, unless they're a very, very well-trained dog, I doubt they're giving their paw to you. So see that as a stress sign. They're kind of, and it usually is cupped with like leaning away and paw up. Now the ears can start to go out to the side, sometimes even pull back against their head, or flatten against their head. And so even a dog like a basset or floppy ear dogs, I look more at the base of their tail, that moves back, even though they don't necessarily flip their whole ears back. And their pupils might dilate. Any dilation can be a sign of stress. Of course, depending on the lighting in the room. You might also see whale eye. And what that is, you see more white of a dog's eye. And that's because they don't want to look directly at the scary thing because it's threatening, but they still want to keep an eye on it. So they'll kind of side eye. So you see more white of their eye, but that still shows that they're stressed. They're keeping an eye on whatever's going on. Some dogs might avoid looking toward you or the scary thing at all. And then some dogs will stare. I do see staring as kind of a red flag, especially in an emergency situation of like a flat stare, like not looking away. If I see that, I'm definitely looking at the body of like, what's the tail doing? I'm guessing the body's tense, the tail's down. Of course, out of context, dogs do stare at their owners that they love and they'll stare at some people, but I don't expect that in the emergency clinic. And I don't expect that with the tight body language. Again, you see staring, look at the rest of the body, see what else is going on. And then with the mouth has a wide range of what it does when it's stressed with dogs. So it could be closed with the tight lips. You might see a yawn or a lip lick. Now, those two are also displacement behaviors because they're normal, but they're done out of context. If a dog is yawning when he didn't just wake up, is not falling asleep, then that is a sign of stress. If they're licking their lips when they aren't anticipating food, didn't just eat, not drooling a ton, that could be a sign of stress. And then it kind of escalates to, you might see panting, usually a wide pant if they're really stressed, like open mouth, the cheeks go back. Then it escalates to vocalization. So you get, barking. There's a lot of context for barking, but barking, whining or growling. And then that can escalate to a lip lift, meaning like they show their teeth a little bit. That can escalate to an air stamp, meaning they bite, but they don't make contact with you or anything. And that can also escalate to a bite. Of course, we definitely want to prevent all of that. All right, so I want to show you this quick video of Floyd, and I will call out his body language. This is him at the vet clinic. He's whining. Pupils look a bit dilated. He's standing pretty still. His tail's down. Whining. I think he did a lip lick, a lip lick, but it was quick. So that's stress. Is it over the top? No. Can it escalate? Absolutely. Okay, so let's talk about cat body language. Now with cats, I put it into 3 categories. We got decreasing distance, which means they're inviting you in. They want to decrease distance to something. There's neutral, meaning they're comfortable. And then there's increasing distance, meaning they want to get away from something. So you're not going to see a ton of decreasing distance in an emergency setting, but just to go through it real quick so you guys can see the difference. The tail, number 1, is going to be up. It's going to be up, flagpole, and I'll say like curved at the tip, like a little question mark. Their hair is usually that flat, natural for them. their posture is going to be approaching you, and they're going to walk loosely, and they actually might raise a front paw. So opposite to dogs, they might raise a front paw because they're curious. Their ears are in that like forward, pretty forward position. Their eyes are going to be a nice almond shaped pupil, and their mouth will be closed and maybe meowing, especially if they're trying to get something from you. So neutral, the difference between decreasing distance and neutral is literally that, neutral. I think cats definitely fall prey to being neutral, and we go up to them and pet them and scoop them up because they look comfortable, but that is not inviting in. So cats don't usually love that. Cats tolerate that. But the difference is the tail is going to be more even with the spine. You might see some gentle movement, very minimal though, especially if they're walking. Like their body's going to be loose, so the tail might move just a little bit. The hair's going to be flat. With their posture, their caudal end by their tail is going to be slightly higher than their shoulders when they're standing. And again, loose walk. And then if they're laying down, their legs are typically out. Now, their ears are going to be that forward position, eyes same, almond-shaped pupil, and the mouth is typically closed. So here's two pictures of cats that are decreasing distance. This one on the left is neutral, borderline decreasing distance. I say neutral because the ears are forward. The pupils are a bit dilated, but I don't know if it's because of the lighting. I don't know. Maybe the cat's starting to get a little stimulated. But legs are completely out. And the only thing that tips me over to maybe being decreased distance is that tail is up. So I would maybe approach that cat, but not touch it right away. I'd want it to approach me. Now, this cat is one of my cats, and her tail is up, ears forward, nice almond-shaped pupil, mouth closed, paw is up. It's a quick video, but I was actually training her, so she enjoys that. So she meowed at me, paw up. And see, there's a little bit of tail movement, but it was up, and she's inviting me in. So here is neutral. So on the left, we got that caudal ends a little bit higher than the shoulders. You see that the base of the tail is going up, but it's not up like a flagpole. So that's important to note. Ears in that forward position, pupils are a little constricted, again, lighting of the room, mouth closed. This is a beautiful representation on the right of legs out when sitting, ears forward, beautiful almond-shaped pupils, mouth closed, and the tail is out. So increasing distance. Unfortunately, this is what we see a lot in emergency care. So increasing distance, we're talking about stressful cats, fearful cats, possibly painful cats. So the tail, well, I should say first, a lot of us picture the Halloween cat. So you think of that black cat with the mouth open, hissing, ears back against her head, arched back, piloerection with the hair up, tail's poofed, it's spitting, it's hissing, all the things. I really hope you guys aren't seeing that in emergency care. If you do, please, let's talk about sedation. Let's talk about sending home some PVPs and such. But hopefully you're seeing a lesser degree of fearful cats. So if I start again at the base or at the back of the cat, the tail is going to be down, maybe tucked underneath their body or around their body. And you might see some fast movements of the tail. So if the tail is wagging like a dog, that's always a red flag. It's always something to be concerned about anyways, especially if it's fast and whipping. You might also see a puffed up tail like the Halloween cat. Sometimes it's just the tail. And the hair, okay, might be flat or could be raised up like we talked about. Now with the posture, if it's not the Halloween cat, you still might see a cat who's stiff, who's very still. We talk about a loafing position. Loafing for cats could be good and also not great. So this cat to the right can be called a loafing cat. So the difference with the loaf is the placement of the paws. So if the paws are forward, that is a cat that's less comfortable because they're ready to spring into action. They're ready to run when they need to. If a cat's more tucked in and loafing, then I go, okay, it's probably pretty comfortable. It's trying to get comfy and warm. Okay. Also with the body posture, they might be leaning or moving away from you. That's definitely not inviting you in. Ears might be out to the side or even back against their head. Their pupils dilated at all, past that almond shape. And their mouth can be closed or it could be open. You might see panting, growling, hissing, and unfortunately biting. So again, this cat to the right, the mouth is open, it looks like it's hissing. Pupils a little bit dilated, but not horrible, not like huge. Ears are already out to the side, arched back. Maybe the hair is kind of poofed up on the back and the tail is tucked around its body and its paws are out because it's ready to spring if it needs to. So here's a lesser degree of stressed cats or increasing distance cats. So this one on the left, again, going through the body language, tail's tucked around the body, maybe a little puffed up, but it's hard to tell because this cat's a hairy cat. So same with the back. Is it a little puffed up or is it just really hairy? Ears are starting to turn out to the side and the pupils are dilated. So this cat looks really focused on something. Again, this is a cat I wouldn't prefer to touch, or I'm not going to just run up to it because that might really set it off. All right, this cat on the right, she is, for one, she's hiding behind the computer. This is at the vet clinic. She is in a loaf position, but her paws are out. Her ears are starting to turn out to the side, dilated pupils. She's avoiding eye contact with me. And then her mouth is closed. So that's some of the body language to watch out for. Again, the biggest things is to focus on one part and then say it out loud, talk about it with your fellow employees so we can talk about like, yep, this pet is stressed, so we can prevent it from escalating. So now let's talk about the environment for them. So I have a few videos here. What I want you to do is listen to what you can hear with the videos and watch their body language. And then I'll talk about their body language after. So this first one, and this is also another one of my cats. That's why I have a lot of pictures of her and video at the clinic. So let me just say right off the rip, she's in a loaf position. She's crouched down, but her paws are forward. Her tail's around her body. Her ears are going out to the side. Pupils dilated. Her mouth is open. So I know it's still a little quiet, but I hope you guys could hear that there's banging going on. There's a conversation happening with a voice escalating. That is all outside the room. Nobody's in the room with us. We're in an exam room, nobody's there. So that's either in the lobby or it was in the next exam room. So again, let me play it. So to go over her body language. So she's meowing a little bit. She needs to come out. And then that voice escalates, her ears go off the side. She goes, no, thanks, I'm gonna back up. I'm pretty worried. Okay, and here is Floyd. Again, listen to what he is listening to. Let me see if I can turn this up a little bit more. I don't know if you guys could hear that as well, but there's a conversation happening. Again, we're in the vet clinic, but this room was actually at the end of the hallway. So there was no rooms adjacent to us. So we heard talking, but it was either in the next room or maybe down the hallway. But again, to show his body language, he's listening. He lip licks. It's pretty stiff. He laughs, so he turned back. And then he's listening again. Okay, here's the same day. I mean, right now you can kind of see his mouth is open, but again, let me make sure this is as loud as I can get it. Okay, so that was simply a swinging door. So that was a swinging door that goes back into treatment. We are on the opposite end of that hallway. So I would say at least, I'm not really good with feet, but at least 25 feet, if not more. But it was enough to make him stop. So he's already panting, tail down but wagging a little bit. You heard the noise. He's alert for it. He lip licks. There's panting some more. Okay. Yes. So those aren't over the top, but that just shows how these little sounds can affect them. Is it going to cause stress? I mean, it's not going to be the be all end all right? Like they're coming in stress, but it's not going to help. It can help escalate them. And if they're already up this high, that can throw them over the edge. So what we're going to do is decrease their fear, anxiety, stress by decreasing their sensory overload. So I want to limit smells, I want to limit sounds, I want to limit their sights, and then we'll talk about limiting our touch too with them, because limiting these things will help keep that FAS lower. So first with smells, let's avoid strong smelling perfumes and colognes. If we can smell it, they can smell it so much better, and it can be pretty offensive to them, some of the smells that we have, human smells. Instead, you can spray Feel Away or Thunder Ease on your scrubs or clothes. In case you're not aware, Feel Away and Thunder Ease are appeasing pheromones. So Feel Away is for cats. It's a cat appeasing pheromone. And Thunder Ease is for dogs. It was formerly known as Adaptil, but Thunder Ease company bought it out. So, or the Thunder Shirt company bought it out and call it Thunder Ease. You can wear them at the same time. The cats can only smell the Feel Away. The dog can only smell the Thunder Ease. They don't really counteract at all. And what you do with the spray is literally spray it on your scrubs. It doesn't stain or anything. And it lasts about 4 hours. So it's great to do at the beginning of the shift and in the middle of the shift when you're taking a break. And then with cleaning, we recommend using Rescue. And I really recommend using Rescue because it helps kill the smell for the pets. So some things like Lysol and Mr. Clean and Febreze, I mean, they smell great. They kill the smells for us, but it's not necessarily breaking down the smells for the pets. So that's where Rescue is important. It helps get rid of some of those pheromones that they're releasing that are fearful, and anything else, poop, pee, there's pheromones in that, all of that. But also the great thing about Rescue is it doesn't have a scent. So it's not offensive like some of those other ones would be to cats and dogs. And another thing about Rescue is it works quickly. So definitely we want to use that in between patients. Just wipe down the table, spray the table. It works within a minute. All right. And so it sounds, I just want to use our regular talking voices. So try to avoid the high pitched, being loud. I also want to avoid whispering. Whispering can sound like hissing to cats specifically. So just regular talking voices. And think about how we open and close cages and doors. Like that swinging door, like someone should have just sprayed that, lubed that door up, because it doesn't seem like a big deal, but it definitely caught my dog's attention. It didn't help his stress at all. So let alone if we're like closing doors, you know, those metal doors are very loud. So just think about it, be cognizant of it when you're opening and closing cage doors. Do as much in the exam room as possible. I know this is hard in emergency clinics, and I know it's going to change, like depending on what your guys' setup is. But if you can do stuff in the exam room, that limits all those things, the smells, the sounds, the sights, all of that's eliminated because they stay in one spot, and that's going to decrease FAS. And that's definitely easier with, coughing, GI upset and stuff to start. But if we can do as much as we can before we transfer them to the back, that is helpful. And with that, we want to have supplies ready. So either have supplies in the room, in the exam rooms, you're going to use the exam room, or I know emergency clinics are wonderful at having stations of a lot of supplies, but try to have the supplies ready as much as possible so you're not moving the animal around and you're not necessarily going back and forth from the animal. And then as far as touch goes, we're going to use low stress handling or less is more handling. All right, so let's talk about the age-old question of, are pets better in the back? Most of the time, they are not better away from their owners. The reason, and this has been an argument in vet med of, yeah, but when we take them in the back, we can get stuff done. Unfortunately, that is what you're seeing, a version of the freeze in those 4 F's of fear. It also can lead to learned helplessness, which I have written here, which is where they basically realize they don't have any control. The dogs and cats realize they don't have any control, so they just give up and they just go, fine, just do it. Yes, we can get our stuff done that way, but that doesn't improve their quality of life in that situation. It doesn't improve their stress. It can make them more stressed in future visits. Um, and again, some people say, well, pets are more likely to bite or growl or hiss in front of their owners. Now, that can be absolutely true. And the reason is not because they're worse with their owners. I definitely want to refrain from saying that. For one, because it's not true. And for two, because it makes the owners feel pretty badly about themselves that they're like, oh, the animal's worse with me. I guess take them in the back. But the reason why they might act out more is because their family is their support system, it's their comfort. So we see it as if you have your backup with you, you're more likely to tell someone off that you want to tell somebody off. Okay. If you're alone and you don't like somebody, you're probably less likely to say anything. But if you got your crew, you're more likely to speak up. So that's what we see in the room. So the stress level doesn't necessarily change. Sometimes it gets worse in the back. Of course, that being said, sometimes we have to move them to the treatment room. I get it. I also get that, like, we x-rays, absolutely. We have to take them back for radiographs. So when we're moving them to the treatment room, let's just focus on some of these, the sensory overload. So quieter voices, normal talking voices. Think about those cage doors and the swinging doors and other doors. Lead dogs in the direction you want them to go. So like facing them and pulling them is not going to help. They don't want to go with you. They don't know you. So if you go tighter on the leash and you walk with them, it's better to direct them of where you want them to go. Now, if we're moving cats into the treatment room, then we want to keep them in their carriers, of course, as much as possible. If they're not in their carriers, give them a towel, wrap them in a towel, and hold them and support them, like hold them against your body. And then when we're walking by other animals, give a wide berth. I'm sure a lot of you guys are already doing that, but give a wide berth because, of course, the closer you are, the more stress all the animals are going to get. You want to decrease fights, you want to decrease contamination, and it's just more stressful for them, period. And then when you are moving to the treatment room, have a non-slip, a yoga, or an anti-fatigue mat ready. So for big dogs on the floor, we just have that on the floor. It's helpful because it helps their traction. Most floors in emergency clinics are a little slippery, especially with those long nails and stuff. And not having traction actually increases their fear, anxiety, and stress. So if we can give them some traction, that should decrease it. But also it gives them a place to go to, a focus point. We already know with cats, like if you set a piece of paper on a table, they're likely to sit on that piece of paper. Dogs aren't that different, especially in a stressful situation. If you give them a place to go to, if you put a blanket on the ground, they're more likely to go to that than just to sit on the linoleum floor. And then on the tables, I want a non-slip or yoga mat and then a towel over it. So here's what we have at our clinic. We have the yoga mats and then a towel over it. If you put just a towel on those stainless steel tables, they're just going to slide. So that actually will increase their fear, anxiety, and stress because they don't have that traction. So we really just want to give them that traction and that security. And then, of course, in the treatment room, have your supplies ready. Like I said, there's usually stations, but if you need to go get other supplies, bring it to the patient. It's also helpful, like if you need x-rays and if you need x-rays on a pet and you don't have like a ton of animals waiting to be x-rayed or to be radiographed, do everything in the x-ray room. Like bring your catheter, bring your blood work supplies, go and do it all there and then you just take radiographs after. That will help decrease fear and anxiety and stress. Now here's just a picture of like our supplies. We have this in each room, but we have a caddy so we can move it to the patient. So once we get them to our mat or on the table, we move the stuff to them, so we don't have to move them around. And that's on the left, and then on the right, we don't do catheters because we don't hospitalize patients at our behavior only clinic, but we do blood a lot. So we have everything ready in our little kit to carry with us. Okay. So let's talk about considerate approach. So considerate approach deals with the environment, which we already talked about, but it also literally deals with the approach. So with dogs, it's better to actually face away from them. So put your side to them as opposed to facing them directly. That's pretty confrontational and scary for them. Same with eye contact. Eye contact is scary for them. So avoid direct eye contact, face to the side, avoid leaning over dogs, whether they're big or small. And if you're bending down, I'd rather you not bend down like right next to a dog because that can be scary. You're a scary person and now you're right in their face. It's better to go like maybe a foot or two away. You still have the leash. You bend down, go to their side. They're more likely to approach you and see you as less threatening. So here's a quick video of one of our techs. So the owner's bringing the dog to the table. The dog's already muzzled, and the tech's already to the side of the dog, and she just wants to slip in and put a towel wrap around the dog. So she stays to the side, she's not in the front. She just slips in, puts the towel so she can better restrain the dog, and then she stays to the side of the dog. Okay. Now for cats, similar. Stay to the side of the cat. It's actually better if a cat faces away from you. So if you're a veterinarian or even a tech who's doing something by yourself with the cat, just face it away from you. You can do a lot of your exam that way. And if you are facing the cat, because sometimes we have to look at the eyes or do other things, it actually helps to blink slowly. That actually calms them. So here's a quick video of our setup for this exam. So we got the doctor listening on the far end here, the tech on the other side. So they're on either side of the cat. They both have hands on the cat, but it is a loose hold. The cat's not going to jump off the table because she has a hand by the chest. The owner's in front offering food, and the cat's allowed to look around. Now, if we held this cat down, the cat's going to likely freak out, likely increase that stress. But the fact that we're just holding loosely, listening, she can get a better listen to the heart, and the cat decides to start eating. Okay, it is hard getting cats out of carriers, especially when they're stressed. So with carriers, if the ideal carrier is one that we could take off the top. Of course, try to be quiet when taking it off and putting it on, but still, that's still better than doing anything else. If you can take the top off and leave the cat in the bottom of the carrier, that's going to be super helpful because that is now their safe spot. It smells like home and it has that edge that raises up so it feels like they can hide a little bit. And you can do an exam, you can do blood pressure, you can do blood, you can even do a catheter with a cat in the bottom of a carrier. Now, if you can't take off the top, you can always put a towel for those ones that open in the front. You can always put a towel in the front of the carrier, which I have a video of, and a cat will come out into it sometimes because they want to hide. Giving a cat a towel is super important. I'll say that probably a few more times, but the cat wants to hide. So giving it a towel to leave the carrier and go hide in a towel is sometimes a preference for them. If the carrier has a top door, or it's not coming out the front door and it has a top door, use a towel, go down with a towel and bring them up with a towel. And same if you have to with the front, if they're absolutely not coming out, use a towel to bring them out as opposed to just hands coming at them. That's a little scary. And you're already giving them a towel to hide under. Excuse me. And then once you have that cat out, don't hang them in the air. Support their legs with like your arm, hold them against you, or put them right onto the table because they want to feel stable. They want to feel some control. So here's a quick video of this cat wanting to come out of the carrier. So I just put a towel over the front, and the cat said, "Thank you, I would love to hide." Came right out so I can scoop it up, and the other tech can move the carrier out of the way. Now I gave it the option of, do you want to remove your head? He says, yes, the cat said. I want to remove my head. So definitely offer cats a towel. And sometimes they'll want to hide fully, sometimes they won't, but give them the option to. And that goes into a big thing of giving dogs and cats some control. we're used to, we have to control the pet. We have to be able to do stuff. So we have to control them. If we release some of our control, it gives them control, which gives them less stress, which means they're not going to fight us. The more we take away the control, the more they go into that fight or flight fear. So I want to avoid that. I'd rather have them fidget. Okay. So like that one cat that was there on either side, it was fidgeting, but it's not, you could still get stuff done. It's not flying off the handle. And so the way to give them control is to keep their paws on the ground or on the table. Lifting their paws sets them off balance, so they already feel out of control. Lifting them up completely absolutely doesn't give them control. And control is actually really big for cats to feel comfortable, because cats want to run. They want to run away. They don't want to fight you. They want to run first. So keep paws on the ground as much as possible with anything. And that will make them more secure, make them more stable. I would say I'll show you some videos, but I even keep, if I'm drawing blood, I'd rather them stand. I don't want to lift their leg. If I'm doing a catheter, I'd rather them stand, because again, it's giving them balance. It's letting them, they're not off balance, because if you lift the leg, they're off balance. So they're already squirming, and then you're trying to hit that vein. But if their paws on the ground, they're very stable, and then you can easily hit it. Okay, so going into gentle control. So this is how we actually handle our cats and dogs, our cat and dog patients. So we start by touching them with one hand, add in another hand, usually along the back. And then we want to slide into the places we want to examine, we want to palpate. Touching and removing, doing that over and over again is definitely stressful. And it will definitely increase their stress. So we just keep hands on a patient, one hand at all times if possible, and move into wherever we need to touch. Again, keep all their paws on the floor. And then, as you saw with one of our other techs, she put a towel wrap around these small dogs. You can absolutely use towel wraps around large dogs too, but they're very helpful around these small dogs and the brachycephalic dogs, that it's hard to get a handle on them and you don't want to make them pass out because you're trying to hold them so hard. The towel will be helpful for that. And it gives them some control too, because you don't have to hold them down. A great book that I'll mention at the end, but I'll mention now too, is the Low Stress Handling book, and like behavior modification by Dr. Sophia Yin, that has wonderful resources for cat and dog handling. They're coming out with a new version this year. Actually, I don't know when, but a new version, they're working on it. So that will be good. And then touch gradient. So we already have hands on a patient. So if we're going to give an injection on the shoulder, then we're going to rub it, scratch it, pinch it, inject. Because if we just go to not touching, grabbing, injecting, they're going to get upset, most likely. So let's try to decrease that. We're going to tell them, hey, I'm doing something right here, and oop, I'm just going to slip in a needle. So it's less dramatic. So here's a video of us getting into position for a blood draw. So we got the anti-fatigue mat on the ground. I'm directing the owner to kind of get the dog on the mat, and also facing the owner because she's going to give him food. The tech comes in, one hand, two hand. She bends down and slides her hands into place. So one on the chest around by the neck, one underneath the abdomen. I'm going to come over with my blood work kit. I start touching the back, move down the leg, and then so I can apply some alcohol. Now, what I don't love is I remove my hand. I probably should have kept my hand there, but afterwards, and I would just have to go touch again down to that spot. So I'm going to poke and get some blood. Okay, gentle control for cats. If you walk away with anything from tonight, I would say give the cats a towel. Offer all cats a towel, always. Most cats want to hide. If they don't want to hide, okay, then they'll come out from underneath the towel. But we're going to use the towel to better restrain them as well. If you give cats a way to cope, they will do better. And hiding is a way to cope. And again, keep all paws on the surface. Try not to lift them too much. You're going to slide your hands into place like you are a dog. Put hands on, slide into the place you want. Touch gradient as well of the touch. I'm pinching, and then I'm giving injection. We want to avoid scruffing. We want to avoid muzzles with cats. There was some guidelines by the AAFP and the ISFM, the Cat Friendly Veterinary Guidelines that were released in 2022, and they're kind of the gold standard. So they definitely say avoid scruffing, avoid muzzles. And honestly, I say that from just practicing for almost 20 years of we don't need it. Scruffing definitely, I definitely learned in school. It definitely increases anxiety and stress. And if a cat is already painful or an older cat that's kind of arthritic, that's definitely going to make their fear, anxiety, stress worse. And honestly, like I said, we don't even need it. What we need is a towel. So look up the low stress handling book. They have not sponsored tonight, but I'm definitely a proponent for low stress handling. Look at the book because they have specific towel wraps for cats, and you do want to get good at them. So if you just try to towel wrap and you go, oh, this doesn't work, the cat got out. Well, you do need to practice. But honestly, even if you don't do any of those towel wraps, if we do a makeshift towel wrap, it will work. So I will show you a makeshift towel wrap right now. So it's none of the specific ones from low stress handling. So the owner took the cat out of this very large carrier. I grabbed the towel from the carrier because it's going to smell like home. So it's going to be better for the cat. I give the option to hide. The cat says, thank you. I'd love to hide. I have to locate where their head is. I can't let the cat go off the table. And I want to know where their head is because it's underneath the towel. So I got to control by their neck. Okay, I'm discussing with the other tech of like, what's our plan? We got to get blood work. We probably have to do a cystocentesis. So I raise the cat slightly to move into place because I want it to be forward. So it's facing away from us and the owner could be there to comfort. One of the veterinarians is offering food. The cat says, no, thank you. And I also let the cat come out to see, like, do you want to hide? And the cat went back in and said, yes, I do want to hide. Okay. So I'm going to keep the head covered. And basically, I'm going to use my thick towel to wrap underneath their head. I'm going to expose the cephalic vein for blood. And then I'm actually going to wrap more towel underneath their neck. So I have control of their body. I have two hands on. I'm literally, all I have to do is hold the head, hold the neck right there, and hold off the vein. And the cat has nowhere to go. And the cat doesn't fight it either. All right. So what happens when their fear, anxiety, stress does elevate? Then we need to take a break. So we usually say 3 strikes you're out with dogs, 2 strikes you're out with cats. You get less chances with cats. So try to get a position, try the gentle control, the considerate approach. And if they're still squirming, it doesn't work. Okay, stop, take a break, reassess. Should we be doing something different? Is there a dog staring at the cat and that's why the cat's upset? Is there barking happening? Was I holding too rough, too hard? Was I lifting the legs and I didn't mean to? Okay, reassess your handling and try again. And so you get 3 tries for a dog, 2 tries for a cat, and then you have to decide, do we need a sedative? Do we need to sedate this cat? Do we need to sedate this dog? Because if they're up here, Fear Free has this lovely graphic right here of when to go, when to have caution. So definitely like when to take breaks and when to stop. And stop means we need a sedative or we need to address, like, do we need to do stuff now or can we actually set the patient home and readdress some of the things another day? All right, so what happens when we have to hospitalize a patient? It's best to separate cats and dogs as much as possible. A lot of emergency clinics have different wards, which is wonderful. If you don't have different wards and they're just in the general treatment area, try to put cats on one side up high, dogs on one side down low. And then limit the amount of people that are interacting with these patients. If it's a different people each time, they're going to get scared each time because they don't know this person. But if it's a familiar people, like if it's the same person on the shifts, like I want the same tech or the same doctor, of course, the same assistant dealing with them, doing the rounds, getting their vitals. And use towels on cages. I would usually cover up either half to 3/4 of a cage for both cats and dogs because it gives them, for one, it gives them an option to hide and to come out. It also just blocks views, period. If we're doing something over here, I want to block the dog's view so he doesn't see what's going on unless he really wants to peek. Also, I don't want to completely cover the cage because I want to be able to see my patient and to make sure everything's okay in there. And then with cats, again, offer a towel. You can also offer a paper bag, a box, anything for a cat to kind of hide into. So this is a great little container that's upside down because it also gives, in this picture, it also gives a perch on the top if a cat's staying a long time, because cats also like to be high, but they also like to be comfort and in an enclosed area. But what you could do is you could use literally a paper bag, throw it away when you're done. You could use a box. I used to cut holes in boxes and actually have a cat house. And then when I need to get the cat out to do something, I take the whole box and you can open the box and then do stuff with them. But even if you don't have that, if you have canned food, prescription canned food at your clinic, it comes in those short boxes. Those are great for cats. You just stick them in any kind of little bit of a lip like that, helps them feel protected. You throw a towel on top, you're golden. Like that is super helpful for cats. And then once they go home, you throw it away. So that is helpful for them to cope. If you can use white noise, music, or a TV in the treatment area and hospitalization, that is helpful. It helps to drown out noise and of course calm them too if it's specific calming music. The music and the TV are nice because it helps with the dynamics of sound. White noise is nice because it's just flat across, like white noise, or actually even a wave sound you can use. Of course, we don't want them too loud because we want to be able to hear like beeping of the machines when we need to. But any little bit of noise like that will help buffer some of any noise that might happen. Of course, cages and doors, we already talked about opening and closing them softly, cleaning between the patients with the rescue. So nothing's wrong smelling, but getting rid of all the smells of the other pets because that can be stressful. And then consider Thunder Ease and Feel Away plugins and spray. So the plugins, again, they don't counteract with each other. You can put them in the same room and they cover about 700 square feet. So we could do that in the treatment or hospitalization areas. You can also use the spray that you're spraying on your scrubs. You can spray the cages. What I used to do is put towels in, I prepare the cages, put towels in, spray it with Feel Away or Adaptil, or I should say Thunder Ease, and let it sit. Because with the spray also, you need about like 10 minutes or so for it to dissipate because it is alcohol based. So initially it's very strong and not helpful for cats and dogs. But if we let it dissipate, that can be helpful. And then if you're okay with it, use their own towel or a blanket in the cage so it smells like home. All right, when we're doing treatments and procedures, of course, I can't touch on all of them, so I'm just doing a broad overall view of it. Have your supplies ready, as we always know. Come to the patient, don't move them around. Stay in one place. Limit how many staff members are interacting with them, with the patient. Face patients away from each other. Try to block their view with your body. Put towels up of like, you know what, if the patient's right next, if the treatment table is right next to a cage, okay, then we need to block that cage a little bit too, and maybe block your body so they're not just staring at each other. This is especially true for cats, but for dogs as well. Yeah, I said keep the patient in one place. You can do injections and subcutaneous fluids in the cage with them. That limits who's touching them, that limits taking them out and dealing with all the stuff. The cat can stay in their box. Of course, I want you to be safe. If you need somebody else to come in and kind of help restrain, or if we think this dog might be very painful and might react, we'll think differently. But try to keep them in one place. We could do a lot of stuff in their cages. You could apply lidocaine gel for injections, blood draws, and catheters. It does need some time to sit, but that can help relieve any pain, especially for animals that are really sensitive with their skin. And again, keep 4 paws on the floor for blood draws and IV catheters and things. So here's a video of us drawing blood on a cat. So again, a loose towel wrap. I have the cat backed up against me, facing away from me. I'm just holding the head up loosely. And the cat's not squirming. The cat's doing nothing. I'm not holding its leg. It's got 4 paws on the ground or on the table. So this is happening in real time. And we're done. And we kept them in the exam room, so to limit all the sights and sounds and everything as well. And I should say, we also always have a white noise going. It's in the corner over here, or on the table over here, I should say. So the same cat, we just drew blood. Now we're going to do cystocentesis via ultrasound. So this is already after the blood draw. So blood draw is going to raise their FAS. So I did a different towel wrap, just kind of re-wrapped it, still very loose. You see the front paw out, the head's out because the cat did not want to hide its head. The owner's here. She's staying back, but she's there for support. And so the cat's not seeing us, the cat's seeing its mom. The one regret I do have is having the alcohol bottle right in front of the cat's nose. That's probably pretty strong for it. That could have increased its FAS. The cat, and I think I pointed out, and then the cat does sniff it. Okay, maybe it's a good thing for distraction, but usually alcohol is pretty offensive to cats. But I'm just having a loose hold, my hand's just on its neck, on the towel. So I'm not scruffing, but if I needed to scruff, I can scruff the towel at that point. And then my leg, I'm not stretching the back legs out. I'm just holding the back legs. So the cat's pretty sternal besides the back legs are kicked out. So she can look for the bladder. And she was able to get it. All right, so back to why do we care about reducing stress in our emergency patients? Well, it benefits everyone. So we get our treatments done. The treatments and procedures get done for the patient. So we are actually obviously physically helping the patient, but also we are emotionally helping the patient. Because how bad do we feel when they're already painful and, oh, we got to do stuff to them, we got to manipulate them. So let's not increase their fear, anxiety, and stress as well. And then I will throw out there that one negative interaction causes stress for future vet care. And that could be an emergency, that can be in primary care, that could be in specialty. So I want us to help each other out in the vet field of trying to make everything as fear-free as possible, no matter what kind of care we're giving. Because if they experience fear in one spot, with veterinary care, it's likely they might repeat that. They remember it very well. And then, of course, remember, we're not talking about no stress. We're talking about less stress. All right. So if you have any questions, there's my work email, my personal email, and also some of the resources for you guys. Of course, fearfreepets.com has wonderful resources in there. One thing I was also going to mention with Fear Free, besides they have wonderful graphics, they did have a handout of like sitting in the spot, sitting in your clinic and like listening and seeing things and writing stuff down of what you interpret for the pets. So that can be helpful. The Low Stress Handling and Restraint book by Dr. Sophia Yin. I also use a Feline Behavioral Health and Welfare book. And then you can go on catvets.com to look at that 2002 Cat Friendly Veterinary Interaction Guidelines.